Okay, so hello. I hope you all are doing well. So today, I will just explain what I have delivered up till now. We have delivered two classes. One, both for beginner and one main class. Right. The topic of today discussion is like first you have to learn the meta-analysis uh, methods, right? And this is you will learn it by the end of this workshop, and I promise it. Now, the question which maybe many students ask from me is regarding the topic selection. This is really an important question, right? But I will share my screen and I'll share what you need to do for a good topic selection, right? For example, if a specific person say to me that I am interested in vascular surgery, or I'm interested in aortic surgery, I'm interested in cardiothoracic surgery. So the first thing is she need to ask from ChatGPT, like she need to ask from ChatGPT. One thing more before going to ChatGPT, the important thing is like you need to you have two options. If you are interested in a specific field, you have two options. Either you go with the original research, or you can do systematic review and meta-analysis, both having its own plus minus, right? Benefit and drawbacks, both having. But as a student from countries that have no that much involvement, that much support and original research, you can do systematic review and meta-analysis, because in evidence pyramid the systematic review is at the top. That's when it is really good. The systematic review and randomized control trial, systematic review and meta-analysis of our cities, these are at the topmost position of the evidence of pyramid, right? What's wrong with the individual studies? Individual studies are limited to a specific region, like Netherlands, like US, like China, and they are not, and their results are not generalizable to the whole world. In order to generalize the results, meta-analysis is a way to pool their result quantitatively, right? For example, for example, this is a study. I don't know from where it is. Let me see. This is a study from where. Thank you. This is a study from where. Actually, let me cross it and see. I think these are all W. Hu Zheng. So I think that will be most likely from China. And what about this one? This one. Yeah, Switzerland. And what about this one? This one will be from Canada, most probably, I think. And Department of Sciences and Center, Canada. So yes, both are on the same topic. Their topic is stroke in the medium distal vessel. I define what mean by medium distal vessel. Anterior cerebral, middle cerebral, and posterior cerebral. They are divided into segments on the basis of their size, right? Large vessel and medium vessel, right? So they are talking about when a stroke hit these medium and distal vessels. So the treatment can be endovascular plus best medical treatment versus best medical treatment alone. And they see with which one either with EVT plus usual care, best medical care, the death is towards the death compared to the usual care. Actually, with the addition of EVT, is there something? Is there any advantage of EVT if we add it to the usual care? Right. So they are assessing these both things, and all the three trials are on the same population, same intervention, and same control. Right. They are assessing whether the addition of EVT to the best medical treatment, benefit us, or it's futile. It's useless. Like, if there is no difference, then why you add EVT? Endovascular therapy, right? So the thing is that, and visually this paper is related to China and the population of China. This is from, I think, Switzerland. This is from Canada. So this is limited, their result is limited to 255 and this much population, and limited to Canada. This is limited to mm, I don't know where, but limited to a specific geography. And this is limited to China with a specific sample size. If we statistically combine these all numbers, as their population is same, their intervention same, control same, they are assessing same things. So our population will be, will be bigger than any of them individually. So our power will be increased, our results will be generalizable, and our evidence value will be greater. So that is the advantage of systematic review over original studies. So yeah, as a student of third world countries, what we can do is we can do systematic review and meta-analysis. In evidence, this is more, evidence rank is upper. And furthermore, if we do a systematic review or a meta-analysis on a specific topic, then we will have a better understanding of this topic. So if I'm interested as a student in a specific field, systematic review and meta-analysis will highly elevate my concept, my knowledge about a specific topic. Right. So this is another advantage of systematic review and meta-analysis when you are interested in a specific field. So that's the advantage of systematic review over another or the other things. Now, so this is the important. Now, second thing is topic selection for regional. The criteria is different. Regional result, the criteria is different. By the regional result, I mean just like they take some patient, right? And these are original results. In combining their results into one thing in a meta-analysis, that's the meta-analysis. That's a review. You review the whole literature on the population, which you define. This your population is this, and this. Patient with a stroke in medium and distal vessel, having intervention this, having control this, and they are assessing for these and these things. These are the outcomes, like MRS scale, right? And death, symptomatic endocrine hemorrhage. So these are your outcomes. So this is the thing. Now, as I said, now I will come with the next topic. The next topic is like, the next step is the question topic selection. The topic selection for regional studies, I remember from my teacher in our college, I think he was talking that for topic selection for regional studies is a criteria, final criteria is, I remember, I don't know what, I think it's feasible and economical, that should be doable, that should be ethical, right? Morally good in a specific setting in an MMC. Now, if I'm trying to do a research about this thing, about this topic, EV thrombectomy versus control in a Mardan medical complex, I won't have that much resources. Even our professor don't have that much resources. So this is the thing. So the criteria for original research is different. You will define the criteria according to the resources you have, but the criteria for meta-analysis, the criteria for meta-analysis is different. You just need to have considerable number of studies. By the considerable, I mean at least 4 papers on that specific topic and no prior meta-analysis on that topic. Because if you have, if you have 4 papers, but they are already used by a systematic review and meta-analysis, then no need, because if a literature already have a meta-analysis on this topic, why are you doing next? What value will you add to the literature? If you don't add any value to the literature, don't need it, right? Yeah. So so this is about the criteria for meta-analysis. As I said, considerable number of studies and no prior meta-analysis on that topic. So yeah. Now the next step is, you will say that how can we have topics, right? How can we have topics? So regarding this, what I will suggest you is, first, for example, I'm interested in vascular surgery, or I am interested in cardiothoracic surgery. I'll hey chat GPT. Hey, I am a medical student interested in vascular surgery research. Yes, surgery research. Can you please suggest me top 5 journals? Because journals में आपके पास original studies publish होते हैं ना. Because meta-analysis you can do on original research. If you don't have any original paper, what will you combine? So for meta-analysis, you need to look for original papers. And where you will find original papers, you will find it in the journal where it's published. So if you are interested in a, let's say, plastic surgery, so it is must that you know at least top 5 journals of plastic surgery of the field you are interested in. You should at least in a week check their papers. What are the publication in that paper, right? So this is one thing. Know the journals in the field you're interested in, right? Okay, so I'm a student, medical student, interested in this specific field, right? Can you please suggest me top 5 journals in my field? Thank you. Right? Yeah, this is the topmost journal of vascular surgery. And I have a paper in this journal, European Journal of Vascular and Endovascular Surgery, Journal of Endovascular Therapy, Annual of Annals of Vascular Surgery, Journal of Cardiovascular Surgery, and yeah, so additional. So these are not that much related to vascular surgery, but you can say. So yeah, so the first journal is Journal of Vascular Surgery. That's right. So what will you do is the next step is you need journal, JOURNAL, Journal of VASCULAR Vascular SURGERY, right? Journal of Vascular Surgery, right? You will visit this journal and you will see what are the recent publication nowadays, right? So online first, short communication, the silent giant, something I don't understand this. Review article, contemporary systematic review and meta-analysis of outcomes associated with femoropopliteal above the knee non-autologous surgical bypass. So this is a systematic review and meta-analysis. One thing really important, please listen, really important. If you need to improve your skills of meta-analysis, right? Specifically, know more ideas about meta-analysis. I remember one of the quote from the Renderson Cardoso, or my mentor, right? He said to me, all ideas comes from other ideas, right? It doesn't mean I will copy this specific meta-analysis, but I can take ideas from it, like 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 what they did in their specifically meta-analysis of your field. If you are interested in plastic surgery, you should read the plastic surgery meta-analysis. You should see how they present their data, how they made their table 1, right? So this is how they made their table 1. Nice. How many studies they have, how beautifully they arrange the systematic review. This is Prisma, and this is a really great Prisma diagram. Figure Weaver. Let me see this in full. Let me see. Yeah, this is the beautiful systematic review. See, previous studies, records included from previous review. इसका मतलब है कि इस टॉपिक पे पहले रिव्यू थी, इन्होंने अपडेट किया है. सो कितने ऐसे स्टडीज इनको मिले जो कि प्रीवियस मेटा एनालिसिस में ऑलरेडी थे, राइट? So if I am doing a meta-analysis on a topic in which already we have a meta-analysis, so by this way, you can write records included in the previous review. This is amazing Prisma diagram. After that, so these are previous studies in the previous meta-analysis. Identification of new studies via database and registries. So Embase, PubMed, इतने articles थे, सही है. डुप्लीकेट्स मैंने कल बताया था, detect duplicates, you will click and run on detect duplicates, and you will resolve the duplicates. When the duplicate is resolved, so you will have a specific number. For example, at the start, you have this number, like adding the embase and PubMed, and that's equal to, for example, 500. What? It's equal to 500. And you detect a duplicate of 50. So duplicates removed. How much you removed? Remove the duplicates. It's 50. So how much will you will have remaining? It's 450, right? After that, you need to do screening titles and abstract. You will include some, you will exclude some. So after that, out of 450, maybe you just include 15 papers. So this will be 15, right? Because assessed for eligibility. What? Okay. So 42 is this one from previous papers and from other way. Okay. So the total, for example, as it's 15. Then you need to read those 15 and the full text, right? So after that, you are reading paper in the full text, and now you're thinking that this specific paper is not likely to be included in our topic because review without new data. You should give reason, and adequate sample size. You are excluding a specific number of studies because of wrong intervention, because they are conference abstract with concurrent full paper available, a post hoc study, preliminary results, retrospective analysis, missing sub cohort analysis data. This is really a beautiful systematic review prisma diagram. Really, I'm impressed. Really impressed. So after that, you will have, for example, N15. When you read the total 15, and you exclude some paper, and you give reasons that I exclude these papers because of these, and these, and you now come up with a sample size of, uh, just 5 papers you have. So records included in the quantitative synthesis, in the meta-analysis. That's 5. That's another thing. But I'm impressed, as I said. Really beautiful thing. So, okay, so what's this? Identification of new studies by other methods. This is beautiful. What mean by other method? Records identified from systematic review. What mean by this? Actually, this is not a good way. I mean, you can have like give heading records identify via snowballing. Records identify via references of the studies. Like you have this number of studies, right? You have this number of final studies, which are 5 or 10 or whatever the studies is, and you see their references. And now you're saying records identify via snowballing. Yeah, that makes sense. So yeah, so by this way, this is a prisma diagram. So this is a really beautiful diagram. So I got the idea from already a meta-analysis published in the field. I'm trying to work in. Wow! This is a singular meta-analysis. This is a singular meta-analysis. How many studies that have? Let me see. 16 studies. So yeah, what I said. And in single arm, at least you have more than 10 studies. So Manahel and other one, Jawad Sheikh, I think. So you people are saying that you are working, both are working on a specific topic. I think I don't remember it here, but it's singular. So you should search for it. And yeah, you see this? This is a singular meta-analysis. Yes, this is a beautiful singular meta-analysis. It's also called as proportional meta-analysis. Right? And let me see for which outcome it is. A, B, and C, and D. So A is for 12-month oral pooled analysis. B is for primary patency. These are the outcomes. You don't worry about it. I know you will say that I don't understand primary patency. It's okay. You'll got it later. The data extraction you will not know. So secondary potency and these things. And what is this? What's this? This is wow. Like you see. Let me explain my feelings. This is a specific plot. I don't know about this. I never saw this before, but I got idea. How can I present result of my own meta-analysis in a way, in a beautiful way? I learned about this thing from where? From a meta-analysis, which I read in the Journal of Vascular Surgery. Here it is, sorry, in the Journal of Vascular Surgery. So when you are reading paper and your field, you will come up with ideas, new ideas. What's this? What's this? Longitudinal pooled event rates showing mortality and patency rate. Okay, longitudinal means with months. Okay, this is the red one is mortality. Mortality is here at 6 months. This is mortality with the confidence interval at 12 months, at 24 months, at 36 months, and events rate. And this is primary patency. Wow. I think this is a kind of Kaplan-Meier curve, but not really, but it's a kind of, because that's what Kaplan-Meier curve do. Kaplan-Meier curves, let me show it to you. In curve. Oh, the hell. And studies or meta-analysis. So yes, these are Kaplan-Meier curves. What they represent? They represent this with the time event. Like actually, let me no, not this one, not this one, not going up in curves, going up, going up. Is it? Yeah, this one. If you see, like with the time, and these are events. So events with time, but their chemical like at 6 months, then at 12 months, then 24, then it's 36. So it's going like this, and yeah, it's I mean at 0, maybe its event is not present or whatever the reason is, but at 0 they don't have anything. And now from primary patency, patency was initially 90%, and then the patency is decreased up to 36. I mean 3 years. Yeah, 3 years. And then secondary patency. Yeah. So I think this is a kind of can cause, not exactly, but kind of. Yeah. Now see this. Now see this. What's this? What is this? Prisma $B's main checklist. Yeah, no, this is Prisma checklist. This is something else. This is something else. A good journal is usually required what? Prisma checklist. And this is different from Prisma flow diagram. This is different from what I have shown earlier, right? The Prisma flow diagram, this is different thing, and the Prisma checklist is different thing. What is this? Or Prisma abstract checklist. This is something else, and this is search strategy. What's like this is another kind of search strategy. Let me explain it to you, because today class will be about this. Oh my god, this is so comprehensive. Oh my god, this is so comprehensive. Okay, this is the best one, but this is really, now they mentioned that like at this specific date we got this number of results. I think this is for PubMed. My god, this is too much. This is too much. You can take ideas from this, but never do like this. This is don't like this is too much. This is too much. Risk of bias, okay. And what is this? This is funnel plot. This is funnel plot. This is funnel plot. You will learn this by the end of the time. You will learn this. This. So what I was talking about. What is this? Yeah, these are the outcomes different. Like they present their results in different form. And from the meta-analysis in your own field, if you look the papers, right, you will have the idea that how you can present your own result in a way that is acceptable to good journals. I hope you got my point. Like, what's my point? So, what's this? What's this? So you need to write original research like this. This is the topic, right? Computer tomography, this and thing. Uh, Open surgical conversion, like these. So open bypass versus endovascular therapy, and this in this patient. Now you can search this. You can assess its viability. If it's viable, go with it, right? So let me go back. Let me go back. So what I said that you need to know great journals in your field. This is step one. No matter what your field is, right? This is step one. What's second step? Obviously, after knowing the good journals in your field, you need to look for it. You need to read papers in them. By this way, you will have idea, right? This is one. Second thing is, second thing is, let me share my, yeah. To see this, I have subscribed different authors. Now, this author, Martin Cisne. Now, a recent paper by this author, when they published, you will notified when you subscribe to those authors, right? Let me give you an example. Let me give you an example. For example, uh, this is a specific paper. You like it very much. You like it very much by M. Goyal. By what? By M. Goyal. Copy his name. You search his name. I mean, you like this author. You like his paper. Oh, wow, she is female. Let me see. Nish Goyal, Boston University. No, no, this is not that one. This is not that one. Actually, the person is and what? Ischemic stroke, right? Ischemic stroke. I mean, yeah, this one. So let me see here. Now you need to search that person. You need to search that person. You need to search this person. This is, yeah, this is that Goyal. And if you see here, Department of Clinical Neurosciences, University of Canada. So now you need to copy this. You need to copy this, and you need to control C it. You need to paste it here. You need to search it, and specifically, you need to and Google Scholar, right? Let me see. Has I have a Google Scholar? That's not showing. Let me delete this. Okay. Oh my god. I think it's too much. And PhD. So the thing is that now I know this person is, yeah, this one. Mani Goyal and Canada, I think. UC Glare. Let me see. UC Glare. Yeah, Calgary. Something like that. So, oh my god, having a lot of citation. Right. So this is the person. Oh, this is the thing. This is the thing. Okay, okay. This, let me explain. Let me explain. Actually, there are different kind of meta-analysis. And the really respected one, what the meta-analysis, which is really respected, which evidence is at the top most. That's individual patient data meta-analysis, having 8,000, about 9,000 citation, right? So after that, a meta-analysis of pseudo individual patient data. That's Kaplan-Meier curves. After that, the one we are talking about. So that's the hierarchy within the meta-analysis. And you can't do this because you don't have access to the individual patient data. Only the person who are conducting trials having the access. So, okay. So the thing is that you need to follow this person, specifically new citation to this author, new articles related to his research, and new articles by this author. So whenever new articles published by this author, new citation to this author, a new a research article related to this, you will be notified by your email when you follow that specific Google Scholar account. You will get you will get the new things, right? New paper, new research, new citation related to that specific author. So this is another thing by which you will have ideas in a specific field like this. 10-year outcome of valve replacing versus valve sparing aortic root replacement and Marfan syndrome. This is a really nice idea. And I know Joseph Kisoli, and I think he is from University of Baylor College of Medicine. Why? Because I know about him. He is really respected person, Joseph Kisoli. See, Baylor College of Medicine. What I want to say is, what the message I want to convey to you people is, you need to connect with the author. Like, for example, let me see the Joseph Escasoli. Now, the next step is, after you follow their, just like you people connect with your celebrities on Instagram and Facebook, similarly, uh, these are your celebrities in medicine, right? And you need to search their X account, because they're Joseph F. Kasoli, and most probably, maybe I already follow him. Yeah, I'm following him. I'm following him. Professor Executive, this and this and this. So when there are new things about new research published, um, when he works on specific things, so you will get notified in your own account. So this is the way, when you follow the peoples which are in, like, he is a thoracic surgeon from Japan, right? So when you connect with those people, no, like, for example, let me share my home, following. So now Michelle Pompasa, he's my mentor and a really nice person. Yeah, he is a nice person. Beside a great cardiovascular surgeon, no doubt. So, like, he shared something. Now, when you read the idea, like, so you will have ideas about the thing, of what's going on in your field. Outcome of percutaneous mechanical aspiration and left side infective endocarditis. This is another thing. So, excited pancreatic cancer poster. The thing is that, now this lobectomy versus after segmentomy. I don't know what's this, but this look interesting. There is no difference. European prognosis evaluation of early stage lung adenocarcinoma patterns after lobectomy versus segmentectomy baseline and clinical stage. Like, they're comparing two things in their population is patient with adenocarcinoma, and maybe their outcome is disease-free survival, overall survival. And now I know about its population, its intervention, its control, and what are they comparing? Disease-free survival probability, and they are saying that there is no difference. P-value is more than 0.05. So I won't take that much time. I will just comprehend that. After that, after you connect with that person, on X account, you should also follow him and your LinkedIn. I think he has no LinkedIn account. He has no LinkedIn account. But the thing is, you need like you see my home. You need to follow the people. You need to follow the people who who are in your field. You should follow them because by this way you will have ideas about, you will have like Nobel at 10 years. So this is about, talking about trial comparing cabbage versus PCI, and left man without additional complex CAD and PCI is non-inferior to cabbage at 10 years for all cause mortality is concerned. So basically use a latest generation drug eluting stunt, do at image guided, and your outcome with respect to mortality is as good as cabbage. However, keep an eye on that figure, only 15% diabetic patient in each group. So now, if I don't connect with that, actually, and LinkedIn, the good thing is I'm connected to Anthony H. Walker, and he likes this. So that's why I got the recommendation about this Dr. Imran Khan. So I will connect it with person because he has FCPS with cardiac surgery and sharing things related to the cardiac surgery field. Right. So this is another way of your connection. So this is how you need to I mean having connection with your with the persons which are working in your field. This is another thing, right? So what first I shared talking about the journals in your field. This is primary thing. After that, the good, the great authors, the residents specifically, a lot of help most of the time you will got from the residents, because those are the people that are really active in research. Because a well grown professor, maybe he don't reply you specifically the like this, the M Goyal, Manit Goyal, maybe he don't even reply to your message, he will ignore it. But if you connect with the resident who is nowadays and has year graduation year, post graduation year 1 or year 2 or whatever the because actually and residency, he needs a lot of paper. So when he is working on your on his paper, so he will help you too. Actually he will need your help when you know these things properly, right? So yeah, this is the third thing, that you need to connect with those people on X and the on the LinkedIn. Follow the journals, follow their Google Scholar, X, LinkedIn, yeah. And by this way, and when you are doing screening with any other persons, by this way you will read a lot of articles and you will get to know about how you can make ideas for yourself. Related on related topic, when you are doing screening on a specific things, you will have idea about more things. Yes, I know our topic is going way too broad, but that's really important, so that you have like the general idea, like how you can search for more ideas. And I think it's important to guide you to connect as early as possible with the senior of your of your field. Yes. What's next? The next thing is search strategy. That's really important. For example, uh, let me see. I've shared multiple ideas. But let me pick up any idea. Read three. Should I check read three? Actually, I don't have that much knowledge, but let's give a try. So, for example, this is a specific topic, and about this topic, I want to do a meta-analysis. And now I have checked its viability, and it's viable. And now I want to make a search strategy for this specific topic, right? How will I make a search strategy? This is the next thing, right? And this is actually to the topic selection. And after that, you make sure that you have considerable number of studies and how you can have ideas for your topic. I already explained this, multiple ways of it. Now you have you check its viability and you know that's viable. Now, how can you make such strategy for it? Obviously, when you decide that a topic is viable, it means you have considerable number of studies, at least for a single arm, at least 10, and for the other, for the binary, at least 5. When you know that you have this much study, what will you do is, I know you don't have any idea about this. I don't know what's the different names for this. This is study 1 you have. Let me see. This is, I think, study 2. First line, and this is read 3 2026, and this is 2026, 2026, and this is, I think, another 10 2025. Something else. Yeah, so now I have 4 studies. Study 1, 2025 by Nasikamoto, right? And study 2 is in 2025 by Go. Study 3 is by Abasiker, 2026, and study 4 is by Goyal, Nitin Goyal. So I have 4 studies. What will I do is, first I need to read the at least what's they're talking about and what's their outcome. After reading that, I need to make a search strategy. And now let's say I'm assuming that the topic is viable, right? Next thing is to make a search strategy. Let's proceed with how you can make your search strategy. I'm sorry, I'm really down on glucose. So okay, so the thing is that what you will do is you'll copy this name, control C it, you'll go to chat GPT and you'll proceed with a new chart. Hey GPT, I'm trying, I want to do a meta analysis on a topic about which I have some studies. I will paste their titles. I will paste their titles first. Okay. Study 1. So this is the way. Let me ask you something. Okay. I have some question from you. I will stop presenting. Making search strategy on a topic. I even don't know. Obviously, if the topic is got viable, it means you have a lot, you search about this topic, right? You search about this topic, so it means you have general idea, but you don't know, like, you have, I mean, 60-70% idea about this topic, but still you don't have that much topic. No, that much. Yeah. My question is, how can you make a search strategy? What I tell you, what did I teach you, what the way I teach. Jawad Sheikh. Jawad Sheikh. I mean, what I teach you, how you can make a search strategy for it. What the simplest way? How you can use AI for your help. Okay, I think Jawad Sheikh is sleeping somewhere. I'll proceed. So the thing is that I explained to you that you need to paste the title here. It's study 1. After that, study 2. No matter how much study you have, maybe it's 4, 5, or whatever the study is, you just need to control C and paste their titles. Study 3. Study 3, control C. GPT is this one. Study 4. There is study 4, this
Asad,
one.
please share
Oh,
the screen. Share the
oh my God.
screen, Asad.
Oh my God. Oh my, sorry, sorry, sorry.
Asad, and
Yes,
this
yes.
research searching strategy, we can simply copy the whole topic and paste and ChatGPT, and we can ask from ChatGPT that give us the title research strategy, and they will
No,
give
no, no.
us all synonyms and or
Yeah, this
every
this this is
word.
one way. This is one way, but but sometimes different studies have some titles that used specific words that may be not present in the other paper abstract, and sometimes maybe GPT missed any specific uh, words. So that is better that you actually what you will do is your search strategy will pull the titles. So your search strategy should be good if you give the title of the paper, because the different paper use different names. This is study 1, this is study 2, and this is study 3. Where is study 4? This is study 1, right? This is distant lesson. Let me distant lesson. Yes. What about study 2? This is safety and efficacy. Safety and efficacy. What about study 3? This is first line aspiration.
Asad,
First line aspiration. Yes. What
what
about
are those
study
mesh
4?
words we use in search strategy?
Okay, okay. Let me tell you. Let me tell you. Once. Okay, so I'm coming to your questions. Please give me a moment. Okay.
Okay.
Uh, so I need you to think if mm, this is a good topic for meta analysis. Also, do you have any suggestions regarding REGR regarding its population selection, selection criteria. Uh, Also, gave me search strategy. No, not give me strategy. Gave me different synonym so that I make a search strategy which is sensitive enough so that it pulls all the available literature, LATERAT, on this topic. Uh, this topic, and I not missed any study. Thank you. Okay. Good. This is a potentially good meta-analysis topic, especially because distal medium vessel thrombectomy is rapidly expanding field in acute deaths. Read 3-4 catheter is a relatively new device with emerging observational literature. Okay. Most currently available studies are small multi-center cohort retrospective with MAC quantitative and this is valuable. Yeah, because all the studies are small studies. When a study is small, there are chances of type 1 and type 2 errors, right? I mean, their statistical power is not that much enough to say anything about, like, maybe the results prone to errors, different kind of error. I know you won't understand type 1 errors or type 2 errors because that's the topic of TSA, trial sequential analysis. But small studies have limitation, and specifically in the and when you have multiple small studies, then the meta-analysis is really valuable. There are likely no large efforts in India focused specifically on this in DMV or systematic review of the really outcomes of aspiration thrombectomy is really outcomes of aspiration thrombectomy using read 3 catheter for distal video is some strength, device specific, clinical relevant, new technology, manageable number of studies, high chance in the appreciable methodology is rigorous. First important question: should you study only read for 3? You have to possible direction. Option 1: divine specific meta-analysis probably best. Safety and efficacy of read for 3 aspiration thrombectomy for DMV or systematic meta-analysis. Novel focused easier method, easier lower heterogeneity, more population. Disadvantage: small number of studies, mostly retrospective, may not allow strong comparative conclusions. This is probably the best option for you right now. Broader aspiration catheter meta-analysis. You can include Red 3, Zoom, Sophia, Catalyst, this. So advantages: larger sample size, more statistical power. Disadvantages: massive heterogeneity, different, this. So this becomes a much more complicated project station. I strongly suggest keep it up to read 4.3 specific. The later you can give a network meta-analysis of aspiration catheter, comparative meta-analysis, device versus device studies, population selection criteria very important. This is where many stroke meta-analysis becomes. You should define population carefully. Patient with equivalent distal measure, middle distal medium, yeah, medium measure, possibly. These are all the criteria for medium, yeah, distal medium vessel occlusion. If someone asks you what's the distal medium vessel occlusion, so middle cerebral artery, segment 2, segment 3, anterior 2, anterior 3, posterior 2, and posterior 3. Yeah, and its branches. You must include only DMVO, include both DMVO and proximal LVO. No proximal LVO. Large vessel occlusion, no. I recommend primary analysis. Majority of the studies have more than are this much. Okay, data for DMS group may be extracted separately. Why? Because a proximal LVO has different anatomies, different. Yeah, that's why. Exclude primary LVO. Good inclusion criteria: adults with IA, retroaspiration thrombectomy, DMVO, prospective retrospective, more than 5 patients. Yeah, exclude case report, technical success report, conference abstract without data, animal next studies. Important outcomes: you should collect successful reperfusion. And these are the criteria. I even don't know what's TICI, but this is the way of learning. But maybe this is some, like, just like MRS score, this is some score for reperfusion, so that they know about whether reperfusion is successful or not. Obviously, when the stroke, that specific organ don't have blood flow. So when you pass aspiration when you get aspiration thrombectomy, after that you will have reperfusion. The organ will be reperfused, so you will know that whether the reperfusion is successful or not. First pass effect, functional independence in the secondary outcome, technical success very important. Define DM, okay, for the new zone interested definition, okay, such strategy ideas. The highly sensitive surgery because other use many different terms, key concept terms, read, aspiration, thrombectomy, DM, stroke. Possible synonyms: D, red 4.3, red space 4.3, red dash 4.3, red 4.3 aspiration catheter, red aspiration catheter. Sometimes papers may mention penumbra. No need to use penumbra. Cavernous, no. Don't need to use this complex word. Still this concept to stroke thrombectomy terms. Okay. Adopt a direct aspiration first line technique. Some people describe this under the adapt. Okay. Such strategy words. Okay. So this is our device. And this is our population. What? Okay. This is a thrombectomy. And this is our these thing. Thing is that they have this strategy having multiple end, 1 and 2 and 3 and when your search strategy having different having more ends, that's become, I mean, you will have really less number of publication. What I mean by this? Like you're saying that a specific paper must have read and its title. So let's check. Having read, yes. Having read, yes. Having read, yes. Having read in its title, yes. But here the red is with space. Red 43 is with the space. Here without space. Here without space. And here with space. So yes, there are different kinds. So now, what mean by this strategy? This strategy is saying you need to pull those paper which having red in their title, and I mean or इसके साथ साथ और भी क्या होना चाहिए सर स्ट्रेटजी में, सिर्फ एड रेड से काम नहीं चलेगा, स्ट्रोक होना चाहिए. स्ट्रोक है, यस. स्ट्रोक है, यस. स्ट्रोक है, यस. Stroke है. Oh my lord. It don't have stroke in its title. So if I'm doing this, this paper will be not retrieved. You will see this. Yes. Because the search strategy is saying that when I pass the search strategy and PubMed, that will say that you need to pull those paper which having red, which having stroke, which having thrombectomy or any of the words here, and which having any of the word this one. This must, a title must have four these words. So the other thing is thrombectomy or okay, one thing. Stroke is acute ischemic stroke or AIA or cerebral infarction. Let me say cerebral infarction. No, no cerebral infarction. No mechanical thrombectomy. No aspiration thrombectomy. No aspiration. No, sorry. No. Okay. The next thing is thrombectomy. Let's see. Thrombectomy, aspiration. Okay, aspiration. Okay. What's next? See here. Aspiration catheter. Okay. What's here? Aspiration. Okay. Aspiration thrombectomy. What's here? Catheter for aspiration. Okay. Aspiration. Okay. So this segment, this specific segment is present in all the four. Right. I mean, maybe some paper having thrombectomy, maybe some having aspiration, maybe some having aspiration thrombectomy, but once I think a person wrote aspiration thrombectomy is not necessary. Yeah. Mechanical contact aspiration and distal medium vessel. Here, any distal vessel? Yes, distal vessel. Distal medium, distal vessel. Yes. Where is distal vessel? Distal vessel. And here, do we have distal vessel? No, we have distal vessel occlusion. So we need to remove the occlusion, right? What about here? Distal medium vessel. Do we have distal medium vessel? Yes. Here, distal vessel. Yes, distal vessel occlusion. Do we have distal vessel? And here, distal medium vessel occlusion. Distal medium vessel. So here, distal vessel. Actually, that's okay, but I think without occlusion. Yeah. Because occlusion is here written, so no need to specify it. Yes. Okay, so the thing is that how we will proceed here. Again, you will go to PubMed. You will go. Okay. Now, let me give you a quick suggestion about. One person asked about mesh term. What is mesh term? So this is mesh database. Click on it, and you will search for certain words. Maybe like mesh means medical subject heading, right? Every word don't have mesh. Some common words, maybe they having mesh. For example, stroke. Where is it? So heat stroke protein, anterior spinal artery stroke. So we don't have, let me see, let me enter it. Let me search it. Yeah, this is stroke. So you need to check this. You need to check this. add to search builder. So this is, I mean, now this is stroke. So you need to use a word with stroke, with mesh and without mesh, right? You need to use with mesh and without mesh. And how you can do this in advanced search building by this way. You need to click on this, and you need to put here results. I mean the blocks, different blocks. First, you need to decide what blocks are you having in your search strategy. So in my search strategy, I think read one is important. That's basic one. After this, stroke. I don't think I think I need to remove the stroke. Thrombectomy one is good. And this, so I think first I will try 4-1. I mean block 1, block 2, block 3, and block 4. But I'm in the favor of removing this block. Right. Let's see. Let's check both one. Let's check both. First, let me copy this. We copy this. Control C. Open MS Word file. The hell? Paste your search strategy here. I mean, yes. Now make it half. Go to top mid. Now it's here. Give me a moment. Okay. So the first one. Remember, when an abbreviation or a word is without space, I mean having no space. Let me see, are you people with me or not? Are you people with me? Everything okay up till now? Okay, that's good. I thought maybe people are sleeping. Okay. Let's go. Need to make it half. Now you see this bar. Here it's saying all fields. All fields meaning if you are entering a specific word. For example, red 43, and you just click on enter and you search it. No. Add to history. So when you look it and you expand it, that's, I mean, you are saying to PubMed that pull all the papers which having red 43, no matter where the red 43 is written. Maybe it's written in the title, maybe written in the abstract, maybe it's written in the supplementary paper, maybe it's written in the discussion methods and the full text. No matter where it is written, just pull me the papers which having red 43. That's mean by all fields, right? But if you click red 43 and mesh, and title or title and abstract, and you add it and you add to history. Now if you see here, and now you are saying to PubMed that, hey PubMed, I need all the papers having red 43 in their title and abstract. Just limit it to title and abstract. So now the results are 2. How much results we have? Just 2 results. And with all fields, how much result I have? I have 3 results. Right. Now let's say I'm interested in this, but I'm saying this, that pull me this word mesh term. But before this, before clicking on the mesh term, make sure whether the mesh term exists for this specific topic or for this specific word or not. Like C. There is no mesh term for red for 3, right? Term not found. So as I said, mesh term is not for every term. Like every term in your search strategy, and you're saying that I will keep it as a mesh word and as a simple word. No, 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 no. You can't do this. There are some words, for example, stroke. Like this is the main word. Mesh actually stand for medical subject heading. Heading. Now, right, 43 is as a too deep down thing. History. So now you see, when you are searching in a stroke, specifically as a mesh term, how much articles you have? You have about 2000, sorry, 2 lakh results.
लाइट चली गई है. यस, लाइट चली गई है, वाईफाई डिस्कनेक्ट हो गया सबका. सो लीव करो.